Frankly speaking, most of the students, they are not aware of it. They don't know what is HPV, how cervical cancer caused.
So what it is, cervical cancer, the major cause is your HPV virus or the human papilloma virus, what we say. So how it is transmitted?
Human papilloma virus, which is a sexually transmitted virus. And the important thing, having a multiple sexual partners.
Dr. Prabakaran, you told about HPV and its transmission, but are people aware about this? The younger generation know about it, or is there awareness about this in the public?
Yeah, recently we did a survey with the students who were
Okay.
doing their bachelor degree.
Yeah.
We spread out some questionnaire. So what is HPV mean? More than 50% of students, they are not aware of it.
When it comes to the therapies, people are scared when they hear the word radiation. They feel that it has a lot of side effects. So what are the common myths you hear about your radiation therapies?
Radiation is of no pain, but there is of gain. Where radiation people will afraid of. But in our day-to-day life, we are exposing to certain types of radiation, right?
What is the role of nutrition in terms of improving the efficacy of the treatment?
The patient need to avoid the intake of junk foods. The ready to eat, we are in a fastest growing world. We never focused on the food which we are taking.
Can certain foods or diets actually help reduce the risk of cervical cancer?
Yes, sure, antioxidant rich foods.
So you think the younger generation has to be more careful with this?
Yes, nowadays the younger generation are very reckless. They are not aware of it. They need to change their lifestyle and related things to get rid of this. And cervical cancer we can easily eradicate. The prevention lies in our hands.
Let's talk about something that most people don't. How your number of sexual partners could affect your risk of cancer. Now, before we jump into conclusion, this isn't about judgment. It's about awareness. Cervical cancer isn't just another statistics. It's personal. It impacts mothers, sisters and daughters, often striking in the prime of life and without intervention shattering the families. Over 6 lakh women are diagnosed annually and more than 3 lakhs lose their battle. Yet, most cases are preventable. It's one of the few cancers we can actively prevent and detect early. So, why does it still go unnoticed until it's too late? Today, we bridge two crucial areas, prevention and cutting-edge treatment. First, what you can do right now, vaccination, screenings and lifestyle changes, including the nutrition. Then we will dive into Dr. Prabakaran's research uncovering the hidden survival mechanisms of cervical cancer and how we can dismantle them. This isn't just about the science, it's about hope and action, whether through prevention or breakthrough medical research. There is a way forward. Let's get started. The science is clear that cervical cancer doesn't have to be a death sentence. With early detection, vaccination, and a new research on treatment resistance, we have the tools to change the future of this disease. Dr. Prabakaran, welcome to the show. Before we dive into your research, I have to ask, why this field, cervical cancer? What motivated you to take cervical cancer?
Yeah, well, during my master degree, there was a professor named Akbar Shah.
Okay.
He is a cancer biology specialist. We have the chance to attend his lecture, a certificate course on cancer biology.
Okay.
My major is MSc Biotechnology, but at that stage, studying about a biomedical field on cancer, it is really a fascinating thing. And that time I tend to enroll in this kind of research. And my master degree mentor, Dr. Jabir, he is helpful in it. And he made that so.
We know that cervical cancer, the major cause is your HPV virus or the human papilloma virus, what we say. So what it is, so how it is transmitted and how that creates or is a reason for cervical cancers.
Yeah. Human papilloma virus, which is a sexually transmitted virus, which is a double-stranded DNA virus. Usually, when an individual exposed to HPV, mostly our body it will be prevented. In rare cases, there are total 120 subtypes of HPVs which are present. Among that, 40% it will affect the epithelial lining.
Okay.
And the 30% which causes genital warts, we can categorize it into two parts. One is low risk HPV and another is high risk HPV.
Okay.
In a high risk HPV, precisely that HPV type 16 and type 18 which is the known cause for cervical cancer.
So how these cervical cancer can lead for other different types of cancers?
Yeah, HPV is the known cause, which we already discussed.
Mm.
HPV positive oral cancers, also in men, penile cancer, anal cancer. These are the known cancer which are caused by HPVs.
HPVs, okay. And we have seen that they are more resistant to the treatments, the
Yes.
HPV. And though we have too many diagnostic tools, like we have vaccinations to prevent it, or we have pap smears to check the early screening or the detection with the advancement with the technologies. But still we see hundreds of lives claiming every year for the cervical cancer. So why this resistant?
For example, the first line of therapy is radiation therapy for cervical cancer patients. The radiation prime aim to target the DNA of the cell, but the cancer cells which have the tendency to repair it, which means once an individual is exposed to a radiation therapy, within the 24-hour of time point, it have the tendency to repair. We can classify it into two types, which is non-homologous enjoining or homologous recombination.
Okay.
And then doctors, what they will choose, for example, if a patient getting radiation therapy on day one, in the first dose, which kills the 30% of the tumor cells.
30%?
Yes, only 30%. What will happen? Then the remaining cells which turn into hypoxic conditions, which means deprived oxygen condition.
Oxygen, correct.
For the efficient radiation therapy, oxygenation plays a very important role.
Okay.
But to overcome that, doctors chose fractionated therapy. Every alternate days, they will give the radiation therapy to overcome this resistance. And the important thing, there are several set of markers like EGF receptor, Notch. These are some of the signaling molecules which plays the major role in resistance, involved in the relapse of cancer stemness, as well as involved in the DNA damage repair.
Okay. So that's when the resistance build up. It's not that every cells gets the treatment.
Yes.
So now we have understood like why it is resistant. So next thing is like in what age group the people should go for pap smears or for the screening, or what are other, we have different diagnostic tools. So
Yeah.
can you just shed some light on different diagnostic tools which we can utilize to get early screening?
Yes, sure. It's a very important question. Pap smear test, which is nothing but a swab of culture, which will be screened from the cervix of the woman, and the doctors will check whether it is a normal cell or any cancerous lesions found. As per the CDC, Center for Disease Control and Prevention, they have recommended a woman aged 30 years above should undergo pap smear test regularly in the interval of 3 years.
Okay. So you mean to say that the female who is above 30 years,
Above.
once in 3 years?
Yes.
Okay.
That is the easy way to get rid of this disease.
Okay.
Early prevention is better than cure, right?
Okay, one question here. Why every 3 years? Why not every year? Because the disease progression when it comes to cancer, the symptoms are at the end stage.
Yeah.
But they start, the unwanted cells starts multiplying at very early stage.
Yeah.
And is it not easy to detect early than waiting for 3 years?
Yes, no.
So why that marker of 3 years?
Yeah.
Maybe
I
at the
understand
age
your
of 3
question.
to 50.
Yes. The thing is, we need to understand the mechanism of disease
Okay,
progression.
okay,
Once an individual means affected by HPV, what it will do? First, it consists of 3 stages.
okay,
From the normal to the sin 1, which is called as the cervical intraepithelial neoplasia, where it will affect the basal epithelial of the cell.
okay,
And then sin 2, it affects the most of the epithelium and they enter into it. And the third stage, which leads to the cancer. What it will do? It will hijack the entire genome machinery. There are important thing of 2 oncoproteins, which are E6 and E7. What it will do? As you might heard about the tumor suppressor, which is the first line defense mechanism in our body. The HPV type E6, which dysregulates the function of P53, and the E7, which dysregulates the function of PRB, which is retinoblastoma protein.
okay.
Then what will happen? It will hijack the entire genome machinery and involved in the viral spread, which ultimately leads to cancer. It will take at least 7 to 12 years. Got it?
Okay.
Yeah.
That's why the time.
Yes.
progression takes time. So that's the
Yes.
reason we don't have to go every
Yes.
year, because it has become a part of our annual checkups where every year we do. So you mean to say in the early stages it is not required, that
Yes.
yearly one,
Yes.
because it takes time. Okay,
Yeah.
understood. So once the screening is done and if the turns out to be positive, so what are the therapies? What are the options left for the clients?
And the first line is radiation therapy.
Hmm. What other therapies you suggest? I mean, it's available.
Like combination therapies or
So, I mean, is it only the radiation or chemo or the surgery is the first? What are the possibilities that comes up with cervical cancer once they are detected, whatever the stages?
yeah, it depends on case wise. For example, the first line of treatment is radiation therapy.
Okay.
When it turns into resistant, they will give some other combination of drugs, radiation plus combination of chemotherapy. As I mentioned about the radiation resistance, right?
Correct, correct.
To overcome that, there are some of set of drugs like gefitinib, erlotinib. These are the drug which inhibit the DNA damage repair.
So, most of the time it is the radiation therapy what the patients have to undergo when it comes to cervical cancer.
Yes.
So when the patient goes for radiation therapy, is it easily accessible, or whether the patients are getting their treatment at the right time? So what is the scenario happening?
Yeah, it is really a very important question. As per the World Health Organization, we the people of 135 crores,
Yes.
that World Health Organization recommended at least a 1 LINAC, which is a linear accelerator, is recommended for 1 million patients, which is of 10 lakh. But in India, we have less than 500 LINACs at present.
Okay.
So,
We have
by
to
this
cater.
interview, by this show, we recommend the government to improvise or to include as much radiation facility in each and every district of government colleges. Then it will be highly beneficial for that.
So considering that there is a lack of facilities available, so
Yes.
there is a delay in the treatment what what the
Yes,
patients.
exactly. Most of the patients are not getting the
At
treatment
right
at
time.
the right time. The another
Okay.
thing is, as I read an article, they have mentioned a cancer patient at least they need to travel for a 200 kilometers
Correct.
to get the therapy. As we discussed earlier, that related to the fractionation therapy. Like a chemotherapy, a patient cannot go to the doctor and just show and just get a medicine and they can come back to home. But in terms of radiation therapy, they need to be stay for at least 2 to 3 weeks.
Okay.
You can understand the burden of it.
Got
For
it.
the common people, it is not easily affordable.
When it comes to the therapies, people are scared when they hear the word radiation.
Yes.
So they feel that it has a lot of side effects. So what are the common myths you hear about your radiation therapies, and how do you overcome, or how do you educate the common people or the patient who comes in saying that okay, this is completely safe. I mean, this is what you have to do it. So how do you do that?
Yes, I agree with your question. Where radiation people will afraid of, for sure.
Correct.
But in our day-to-day life, we are exposing to certain types of radiation, right?
Yes, every day we have our gadgets, our
Yes,
Wi-Fi, everything
we can
around
classify
us.
the radiation into two types. One is the ionizing radiation, the another one is non-ionizing. Like cell phones and radio
Correct.
waves, those are non-ionizing. X-rays, which are ionizing radiations, where chest X-rays, mammograms, as well as airport scanners. And another thing, if we are during our flight travel, all the individuals which get a limited amount of radiation exposure. And another thing on during the space mission, where the astronauts they are highly tend to this
Exposed,
radiation
yeah.
exposures. So radiation is of no pain, but there is of gain, which means we can save many lives. I agree with your point that it consists of several side effects such as hair loss, nausea, vomiting. But to overcome that, there are set of drug. For example, for the head and neck patients, amifostine, which is a drug which is recommended by the doctors to prevent the normal cells.
Okay.
Yeah.
Yes, Dr. Prabakaran. So when it comes to reducing the long-term side effects of the radiations, are there research going on, or when you do a research, will you consider reducing a side effect is a factor? Do you consider that you need to focus on dropping the side effects of the clients?
Yes, sure. We will focus on it. And there are several researches which are going on to improvise the patient health. What are the health supplements like rich in fibers as well as rich in antioxidants, vitamin C and vitamin D, which are all plays a major role to improvise the patient health.
Okay. So when it comes to the therapies, it's always we see that people suffer a lot because of the side effects,
Yes.
which in turn leads for the lesser food intake or malnourishment, which we believe that because of which the client is not able to sustain the treatment. Or if you are giving a radiation therapy or whatever the therapy is for any cancers, it's a malnourishment which doesn't allow for them to take up take up the treatments. So to overcome this, for example, when you said that nausea is a common symptom what we see or the common side effects which we see in the clients. So usually we say that try to overcome that. See, you said you gave an example of head and neck cancer where they give a drug to reduce the side effects. So in nutritionally also we can do. That's what we do in Qua Nutrition, wherein we suggest the clients to take something like lemon water, cardamom, at least reduce the symptoms. We may not be able to do 100% of taking away the nausea, but at least to make the client feel better so that the patient can take up the therapies. So we
Yes.
give certain small superfoods which is there in the house, like your lemon water with cardamom, or we ask them to chew on the ice cubes. For certain people, they feel too much of dryness in their mouth, or bitterness or metallic taste in the tongue. We say just rinse your mouth with soda water and then have your meal, so that they can have a better input or they can take the food in much better way. So these are the things what we work around. So you think, I mean, in terms of medicine, so these are the things we do at Qua Nutrition, just helping them to overcome the symptoms. So in terms of medicine, because you're from that fraternity and we are from the nutrition, so from the medicine point of view, definitely the drugs, you say that they can take certain medications to overcome the side effects, right?
Yes, sure. So I totally agree that you have mentioned about the malnutritions.
Correct.
Yeah, you might see in several hospitals when a patient got cancer, totally they will be,
Fine.
yeah.
They look
they will-
fine, perfect,
Yeah.
yes.
Once they get the radiation therapy, they will be totally collapsed. The important thing is they are not consuming the rich dietary supplements. That is very important.
Okay. So according to you, what is the role of nutrition in terms of improving the efficacy of the treatment?
And nutrition plays the major role in treatment phase. The important thing is the patient need to avoid the intake of junk foods.
Correct.
Another thing, the ready to eat. We are in a fastest growing world.
Yes, we want everything ready.
We never focused on the food which we are taking. Foods which are the building blocks
Correct.
of our daily life. The important thing is vitamin C enriched foods, vitamin D, and another thing millets. As you have mentioned about cinnamon, cardamom, as the nature gives lot of food supplements to us, but we are not aware of it, but we are not taking at the right time.
Correct.
We are switching over to the westernized world. That thing need to be stopped. That people need to aware of it.
Understood. So what happens is, like, when the client comes to us, I mean, during the treatment, or I mean, when the clients undergo the therapies, different therapies or the surgeries, it's about eating right is what is important, we believe in. So
Yes.
at Qua Nutrition, we emphasize that they have to eat, they have to stay away from particular foods to increase the efficacy of the treatment. You said that they have to stay away from the junk. Definitely, yes, the sugars or the deep fried or any junk into that matter. And when it comes to healthy food also, we say that there are certain foods which can impact on the growth or which can feed the unwanted cells or the cancerous cells. Like anti-inflammatory foods are important because the base of cancer, we consider it as inflammation. So
Yes.
inflammation is wrong food getting into your body. So we need to work around dropping the inflammation. So we believe that certain foods like your gluten or your lactose, when you're intolerant, can lead for inflammation. So we strongly emphasize on superfoods because we, being Indians, we have a lot of spices in our kitchen which plays a major role in dropping the inflammation in the body.
Yes.
So overall the efficacy of the treatment, because at one point we are giving a treatment to kill the unwanted cells, and at the same time when people take something like sugar,
Yes, simple sugars.
they go and feed the cancerous cells. So it is just that at one side you're giving the treatment, and at the same time you're also feeding the cells. The killing and feeding both happening at the same time. So do you think that people has to strictly follow the diet or focus on nutrition to get better result from the treatments?
Yes, sure. People need to much concerned about it. I agree with your points.
Thank you, doctor. So going forward about the supplements, when it comes to the food, it's one part is the natural foods or natural source what we get, which we call as superfoods.
Yes.
Second thing is the supplements, wherein the concentrated form of the particular food.
Yes.
For example, we say resveratrol. It's from the grape.
Yes, grape seeds.
Yes. Now, next is your astaxanthin or omega-3 from fish oil, from the fish, which we call as fish oil. So these are all great anti-inflammatory, which
Yes.
helps in dropping the inflammation which is created inside the body. So do you think dosing these along with the treatment can fasten the outcome of the treatments? So such supplements, the concentrated sources of natural source, would you recommend taking along with the major treatment so that we get a faster recovery or faster inputs from the treatments?
Yeah, it is totally depends upon the individual health, gut
Correct.
health, and the doctor's recommendation. That plays the major role.
Hmm?
And in another side, I agree with you where an individual who cross the 50 or 60s, the oral intake of the complete supplement,
Hmm?
which is totally stopped. So doctor will recommend the add-on of health supplement as you have recommended. Yes.
Correct. So you mean to say it's very customized, it's very individualistic. We cannot say that, okay, everyone has to take
Yes.
it. It's all dependent on that particular patient's gut health or in what stage
And the
he
doctor's
is and
recommendation.
what the treatment is. So based on that, there is a possibilities and we can incorporate the supplements, but understanding all the characteristics of the patient. So based on the doctor's input, we can definitely
Yes, there are
incorporate
ways.
like the curcumin, the component from the turmeric.
Yes.
See, why this question? Because, doctor, we know that curcumin is a strong anti-inflammatory.
Yes.
But when we take through natural source, of course, our Indian cookings, every day we have turmeric in our cooking. But at some point, it is not sufficient. For maintenance, it is good enough.
Yes.
Every day the addition of turmeric is good enough. But when it comes to meet that high requirement, because during the therapies or during the inflammation condition in the body, we need high doses of turmeric or the curcumin, which is possible to give via a supplement.
Yes.
Okay, so we want to understand, so your input is that the patient should not take themselves directly.
Yes.
Under the supervisions of a nutritionist or a doctor, by understanding their body type, it's okay to consume such anti-inflammatory antioxidants which can help them to have a better life, correct?
Yes, I agree with you.
Yes, doctor. So we have different superfoods, as we already discussed about resveratrol, curcumin, and we have like green tea, which plays a huge role in reducing or slowing the growth of cancerous cells. So how they are useful, how you utilize these superfoods for your research in a baselines, or how things come up with
Yeah.
new things.
Yeah, thanks for asking this question. During my PhD days, I worked on EGCG,
Okay.
a compound
in
from
green
the
tea,
green
yes.
tea, which has the tendency to reduce the tumor suppressor marker, which is FTS, which
Okay.
plays the major role in DNA damage repair.
Okay.
Yeah.
So you mean to say that green tea is going to help in slowing the growth or killing the cells? There are two things. One is like killing the cells.
Yeah, which killing the cells in major several pathways which are leads to resistance to the several other treatments.
Okay, that doesn't mean that. So when when the common people hear that, okay, green tea is going to help in killing the cancerous cells, so they tend to like, okay, then I can drink liter of green tea. So will that help them, or is there any portions? Like portion is important. Like, okay, drinking 2 cups, 3 cups. So what is a basic thing that you would recommend is what is required?
We cannot say that consume as long as you heard about a proverb. Even if it is a amirta, that
Correct.
should be consumed in a minimal amount.
Minimal amount,
right?
yes.
Yeah, the important thing is in our day-to-day life, as you mentioned about the resveratrol from the grapes, curcumin from the turmeric,
Turmeric.
and EGCG from green tea. These all the supplement which has the ability to kill the cancerous cells. So they need to consume in the day-to-day life.
Okay.
Minimal amount. Yeah.
Okay. It's not that just drinking green tea would
Yes.
help them to overcome the issues. So they have to be careful with that. It's also about the lifestyle. See,
Yes, exactly.
I mean, when you told that, okay, it's not that we can do it completely or we can drink liters of green tea. I just remembered it's like when the clients comes in or when it comes to the weight loss, it's like, okay, I drink lemon water in the morning. I'm not losing weight. But rest of the day, it is like they have a random lifestyle where they eat junk foods and they
Yes.
expect just drinking one green tea or one lemon water, they have to lose weight, which
Yes.
doesn't happen. And I believe that same holds good here also, wherein it's just not drinking about the green tea. It
Yes.
can help or support the therapies what we do along with the superfoods.
Yes.
So it's not, I mean, a key takeaway is like, of course, green tea is good in killing the cancerous cells. It's not just about drinking green tea. We have to have a better lifestyle. We need to focus on our treatments, what is required for that. Correct?
Yes, exactly.
Yes. So these are the things which we have to focus on along with the treatment. So it's not about just going to the doctors, getting medical treatment. Also adding these small things in our day-to-day life can improve the quality of the life. Because when it comes to the cancer, we say it's about improving the quality of life once it is been detected. So paying attention to the therapies, the medical therapies, as well as having a clean nutrition can give a better life.
Yes, sure.
Doctor, now with advancement, we have something called immunotherapy, which is newly, which has come up.
Yes.
So what exactly is this immunotherapy, and along with the radiation therapy, or how it is going to help in cervical cancer?
Yeah, very well question. Immunotherapy means we are increasing our immune system to kill the cancer cells. As we discussed about the radiation resistance, right?
Correct.
Where cancer cells have the ability to evade from the immune system. How radiation, which when it targets the cancer cells, which secretes the PDL1, which is said to be a programmed death ligand 1.
Okay.
When the immune cells which attach to the cancer cells, it will involve in the immune escape, which leads to the treatment failure.
Okay.
So at present, doctors suggest CAR T cells from the healthier individual. They will isolate NK cells and they will inject in the treatment patients,
patients.
to improvise
Okay.
the therapies.
So there are many advancement in the therapies, and the immunotherapy is something which is in light now. So can you shed light on immunotherapy, what it is, and how it's going to help with the cervical cancer?
Immunotherapy, which is nothing but enhancing the patient's immune mechanism to fight against the disease
Okay.
through several ways.
Okay. And how it's going to help with the cervical cancer? So it's a combination of radiation or immuno, because sometimes in certain cases it is like immunotherapy is used as a maintenance. So how is it in cervical cancer? Is it predominantly used in cervical cancers?
Yes, there are treatments which are undergone whomsoever having the higher resistance cases. So radiation combination of immunotherapy, which is the advanced treatment modalities.
Okay.
nowadays.
So you mean to say that when there is a high risk of resistance, that is
Yes.
when the combination happens, wherein they take the help of immunotherapies to get better results?
Yes, exactly.
Doctor, it's time for rapid fire. So, Dr. Prabakaran, is cervical cancer preventable even if it is already infected with HPV?
Yes, with regular screening and early detection, it's fine.
What's the biggest mistake people make when it comes to early detection of cervical cancer?
Skipping the pap smear test.
Okay. Can certain foods or diets actually help reduce the risk of cervical cancer?
Yes, sure. Antioxidant rich foods, ginger, lemon, garlic, and vitamin C and vitamin D enriched foods.
Okay. If radiation therapy fails, what's the next best treatment option?
Yeah, there are several combination therapies, combination with chemotherapy, as well as other inhibitors, which break down the radiation repairs. Yeah.
Got it. Are there any new vaccines or treatments to the horizon that could help prevent cervical cancer more effectively?
Yeah, last year they have launched vaccines called Cervarix, which launched in India. There are ways.
Dr. Prabakaran, you told about HPV and its transmission, but are people are aware about this? Do the younger generation know about it, or is there awareness about this in the public?
Frankly speaking, most of the students, they are not aware of it. They don't know what is HPV,
Okay.
how cervical cancer caused, and the important thing having a multiple sexual partners, which is a sexually transmitted virus, right? But they are
Correct.
not mostly aware of it.
Okay.
Yeah, we need to create awareness as much possible, especially in the age of 20.
Okay.
20s.
And what other factors contribute? We spoke majorly about the HPV, but there are other factors along with the combination of the HPV virus and the
Smoking will
something
increase
like that.
the risk of HPV, but there is no direct relations. It
Okay.
may.
So basically the lifestyle.
Yes, exactly.
So people should have a better lifestyle. So it's not that every HPV infection leads for cervical cancer.
Yes.
It's about the combination of your HPV infection as well as the lifestyle which can lead for the cancerous.
Yes.
So people have to be aware about both the things, lifestyle and the infection.
Yes.
So what's the status of the awareness now? Because you did mention the age of 20, they have to be more careful or be aware of about all these things. So what's your take on this?
Yeah, recently we did a survey with the students whom were
Okay.
doing their bachelor degree.
Okay.
We spread out some questionnaire.
Hmm.
So in that we have asked what is HPV mean. Frankly
Okay.
speaking, more than 50% of students they are not aware of it. And
Got
another
it.
thing, we post a question that what causes cervical cancer? They are not aware of it.
Okay.
And the pap smear, most of them are aware, but they are not very clear about it.
Okay. Understood.
That's the current scenario.
So basically, the younger generation has to get more
Awareness of it.
and not to take this more lightly.
Yes, exactly.
So you think the younger generation has to be more careful with this?
Yes, nowadays the younger generation are very reckless. They are not aware of it. They need to change their lifestyle and related things to get rid of this. And cervical cancer we can easily eradicate. It
So,
depends on the
So
people's
WHO
health.
says that
Yes.
they'll be eradicating the cervical cancer
In the
with
year of 2030.
Yes.
So the prevention lies in our hands. We join together and eradicate cervical cancer and save the women's life.